know someone who has died from the coronavirus.
The numbers just aren't good there. Thank you very much, David. We're joined now by Dr. Ashish Jha. He's Dean of Brown University School of Public Health. Dr. Jha, so much to get through. If everything goes according to plan, Pfizer will start distributing the vaccine next week. How were they able to get ahead of this?
Yeah, good morning, Gail. Thanks for having me on. You know, the UK has been doing essentially a rolling review, as your journalist mentioned, and that means they've been looking at the data all along. I think our FDA has been working really fast as well, and I expect to have an authorization next week. So we're only a few days behind them.
So once you get the vaccine, how soon does it become effective, and how long does it last?
Great questions. So, you know, everybody needs to remember that there are going to be 2 doses that everybody needs to get. You may get a little bit of protection after the first one, but it's really the second dose that makes the big difference. And we think you have protection relatively soon thereafter, probably within a week or 2 after that. How long it lasts, we don't know. My hope is it lasts at least a year, but obviously we haven't done those longer term studies yet, so we're not sure.
Are you concerned about the distribution? This is a massive, massive effort, never been done before. What concerns you about that and how that's going to work?
Yeah, you know, Gail, this is probably the most complex immunization effort our country has ever undertaken. It's very complicated because we're going to have multiple vaccines, multiple groups to get vaccinated, tracking to make sure everybody's getting their second dose. It's really complicated. Now, do I think we can pull it off? I do. We're going to need an effective federal government. We're going to need state governments to act effectively. And then we're going to have to work very closely with pharmacies and doctors' offices. It's going to take a lot of work. I think we're up for the task, but we got to, you know, pay close attention to all of it.
Is it important to remind people that many people think, yeah, we got the vaccine, we're all good. We're still not out of the woods yet, right? Don't people need to be reminded about our behavior still matters?
Yeah, Gail, you know, we are absolutely not out of the woods. In fact, we're probably in the darkest days of the pandemic. The next 6 weeks, while the vaccines are starting to roll out, are going to be very, very hard. Lots of infections, lots of hospitalizations, unfortunately, lots of deaths. And I tell people, anybody who gets infected now and dies is somebody who would have gotten a vaccine 2-3 months from now. So we really, really need to kind of watch our behavior, protect people until we get to vaccinations.
Okay, you know, the CDC is talking about changing the quarantine guidelines, moving it from 14 days to 7 to 10 days, depending. Does that make sense to you? Is this a good idea?
It does, and I'll tell you why. Most of the evidence now says that if you're going to get infected, you know, by 7 to 10 days, you are. And so if we can shorten it, we can lower the burden of quarantining. We can make it easier for people to quarantine. And again, this is just, the evidence is changing. We're learning new things about the virus. And so I'm in general in support of